Hayley Farm Talk tonight. We're discussing ACE inhibitors based on the mechanism of action, why they are used, and are they really the answers to controlling cardiovascular diseases.
Cardiovascular conditions such as hypertension, heart attack, heart failure, and diabetic nephropathy are medical conditions that affect a significant proportion of our global population. Angiotensin-converting enzyme inhibitor is a pharmaceutical drug that is most commonly used to lower blood pressure. Research has identified that 34% of those experiencing cardiovascular disease were using ACE inhibitors. Let's take a look at how it all started. In 1965, it was discovered that the venom of a Brazilian snake consists of a particular chemical that inhibits kinase 2. Kinase 2 has the ability to cut dipeptide from the vasodilator bradykinin, preventing it from dilating. Decades later, it was discovered that kinase 2 and ACE fall under the same name. When this was discovered, the first ACE inhibitor was created in 1977, known as captopril. Angiotensin 1 and angiotensin 2 are part of the renin-angiotensin-aldosterone system. The RAS is a hormone system that is responsible for the regulation of arterial blood pressure, renal hemodynamics, as well as fluid and electrolyte balance in the human body. The abnormal functioning of this system plays a key role in the pathogenesis of the cardiovascular and kidney conditions.
Let's take a quick look at what happens in this system so that we can better understand how ACE inhibitors work. Renin is released into the body when blood volume is low. As a renin is able to facilitate the conversion of angiotensinogen to angiotensin 1. Furthermore, angiotensin 1 is then transformed into angiotensin 2 with the help of angiotensin converting enzyme which is located in the lungs. Angiotensin 2 is responsible for the blood vessel constriction, leading to an increase in blood pressure. The heart is forced to work harder to allow sufficient amount of blood into the body's arteries.
The main function of ACE inhibitors is to competitively inhibit the actions of ACE at the AT1 receptor in the RAS system, and therefore preventing the conversion of angiotensin 1 to angiotensin 2, as well as the breakdown of bradykinin. The most frequently prescribed ACE inhibitors include peridopril, captopril, enalapril, lisinopril, and ramipril.
So, how do ACE inhibitors work? Well, ACE inhibitors were initially approved for the treatment of hypertension, that is, high blood pressure. As mentioned, the inhibition of ACE prevents the conversion of angiotensin 1 to angiotensin 2, and thus blood vessels cannot be constricted. The increased diameter of these blood vessels thereby lowers arteriolar resistance and increases venous capacity. Also, by preventing ACE from breaking down bradykinin, these blood vessels can remain dilated. ACE inhibitors can be used alone or in combination with other antihypertensive medications. ACE inhibitors have also been found quite useful in the treatment of acute myocardial infarction, cardiac failure, diabetic nephropathy, and even antisocial behavior disorders. In the event of a heart attack or cardiac failure, ACE inhibitors are used to decrease cardiac output and increase the ejection fraction of the heart. Studies have shown that a single dose of captopril results in a 40% reduction in the filling pressure of the left and right heart. With renal complications caused by diabetes, ACE inhibitors decrease renal vascular resistance and results in an increased blood flow to the kidney. Also, the increase in bradykinin has been associated with contributing to the slow progression of diabetic nephropathy.
When prescribing ACE inhibitors, the patient's history must be taken thoroughly. ACE inhibitors have a drug interaction reaction with non-steroidal anti-inflammatory drugs, diuretics, and lithium. These drug combinations can cause the body to retain salt, water, and potassium, which can decrease the effectiveness of ACE inhibitors. As a healthcare practitioner, it is important to be aware of possible adverse effects when taking ACE inhibitors. A common side effect associated is hypertension, which can make the patient feel dizzy. This is an initial reaction by the body as it adjusts to the new drop in blood pressure. Use of ACE inhibitors leads to an accumulation of substances that were normally metabolized by ACE, such as bradykinin and tachykinins. This leads to a persistent cough which exhibits in 20% or more patients. Diarrhea, hyperkalemia, sexual dysfunction, weakness, and rash are other effects. It may also cause angioedema, known as swelling of the tissues in eyes, tongue, or lips. This is rare but life-threatening. Under no circumstance should the following patients be prescribed with ACE inhibitors. ACE inhibitors may cause birth defects, stillbirths, neonatal death, and are not recommended for women who are pregnant or breastfeeding. The removal of angiotensin 2 may lead to an irregular blood flow, which can damage the kidneys. Therefore, it's not given to patients with certain types of kidney diseases, such as renal artery stenosis, as it can cause kidney failure.
So there you have it. ACE inhibitors are pharmaceutical drugs that are particularly effective at treating hypertension and can assist in the treatment of a small number of other medical conditions. However, patients do need to be assessed prior to taking ACE inhibitors to ensure that they are not contraindicated against taking the drug, and also need to be monitored whilst taking it to ensure that any adverse side effects that arise are controlled. If you wish, you can find further information regarding ACE inhibitors from these sources here.